Okay, good afternoon, everybody. This is Mark Schlussel. I'm the CEO of Curus, and we welcome you to the second in our summer series on drugs and their implications for our lifestyle. And this seminar is on costly cancer treatment, and it's going to be an eye-opener because it really affects, the cost really affects the lifestyle of everybody in the family when somebody is diagnosed with a diagnosis of cancer, and the implications are far-reaching. And I'd like to introduce the two principal speakers who are on the screen now. My background is as a healthcare attorney, so I've spent many years in healthcare representing hospitals and doctors in their corporate needs and business needs. We have Sarah Morel, our Chief Medical Engagement Officer, who is a Master's in Science and a physician assistant. Sarah's expertise, she's our Lead Medical Engagement Officer, is in the patient interface, understanding the patient needs, and she is a star and leads that division for the company. And our other principal speaker, and the principal speaker, is Jared A. Moore, who has an MBA and is a advanced practice clinical nurse. Jared's background is he is a retired lieutenant colonel in the Air Force Nursing Corps, and he served in Afghanistan with distinction as the lead military officer on a base at a hospital close to the border of Pakistan and Afghanistan. And there he achieved some remarkable results. If American soldiers showed up, were brought in with a heartbeat, 99.8% of them went home because he reconfigured the hospital in a way to make sure he saved American lives. And we're thrilled to have him as our Chief Innovation Officer and a leader in Curus. So I'm going to turn the presentation over initially to Jared Moore.
Thanks, Mark. I appreciate it. Welcome, everybody. Hopefully you were able to tune into last month's webinar. That one went over TPAs, PBMs, rebates, third-party administrators, stop-loss carriers, and the whole why are medications so costly. So this is the continuation, part 2 of a 3-part series this summer. And this one, obviously, like Mark just said, and thank you for the very nice introduction, we're going over costly cancer treatment. So today's talking points, we're going to go over what are the national costs of care delivery. And the reason why I put that in quotes is because cost isn't always financial. It never is financial. It's financial, it's emotional, spiritual, physical, etc. So we're going to go over pretty much the whole gambit of it. We're also going to review, Sarah's going to review some pertinent costly cancer treatment medications, the reasons why they're prescribed, and the costs, side effects, and so forth. Then we're going to talk about some really innovative solutions, things that Curus can offer to help drive down costs, and again, costs in quotes. And then we'll open it up to some Q&A and give you the next date and time for our webinar. Okay, so we're going to get right into it. So national costs of care. You'll see that I do have citations here. They'll be in small numbers at the end of these. But there was a patient that was seen, she had cancer twice in her life so far, as if once isn't enough. And it recurred. And the first time, she didn't know what she was getting into because she had very good private health insurance, or at least she thought. And what happened was when she came down with cancer, within the first 3 months, she realized there's no way she's A, going to be able to keep her job, or B, be able to afford the treatment after she loses her job. Because of the type of cancer and the magnitude on her body, she wasn't able to work anymore. And they'll only give you so much medical leave before you're on probation and then ultimately let go. So she ended up within about 6 months of having her first diagnosis, selling her furniture, selling her house, basically almost going homeless. And that was just to make up for the bills that the insurance didn't cover. The second time she was diagnosed, which was a few years later, she hired a money manager. And what that person did was they were able to garner all of her assets, protect them, and then help her file for bankruptcy so she could afford to continue to fight this cancer. She's still alive today, but this is a direct quote from her. Seeing a money manager soon after your diagnosis might give you the best hope for surviving the disease. And I underline this, with your health and your wealth intact. At Curus, we believe health is the greatest wealth there is. However, we do recognize the fact that most people do suffer in the pocketbook as well. So another interesting article I found, or this was in the same article, but talked about doctors and oncologists at Duke University. And they were doing a research study on survivability rates of certain types of cancers. And they found that the unintended consequence of their treatment with all the newer drugs, and maybe one drug is new, it costs 3 times as much, and it might have a 1% leg up on survivability. They were finding that their actual survival rates were going down. So it forced them to actually stop the research study, look into it, and they realized there's a thing that they termed financial toxicity. Well, what does that mean? That means that people were not adherent to their medication regimen because of the depression that they were under. 80% of cancer victims go into a substantial depression, and almost 100% have adjustment disorders, which is understandable. The physical stress of it, and of course their financial losses. So had they been prescribed a drug that maybe gave them 1% less chance of survival, they most likely would have stayed on the medical regimen and gone to their visits. So it's very interesting how much we as a nation charge for cancer treatment. And so at the end of the presentation, we're going to put this up on the website and send out a link for you. And there's a reference slide at the very end if you want to look these articles up. They're very, very impactful. So the American Cancer Society released in April of 2017 a PDF. It's a very easy to read document, but again, very impactful, from their Cancer Action Network. So this is a nationwide network, over 100 different facilities, and they came out with this it's more of a primer than a study. And these are some key points, and I'm not going to read them all to you, but what they're saying is in order to survive cancer, both physically and financially, that you need to have quality health insurance. Now that seems like a no-brainer, but a lot of people that do have what they call quote unquote quality health insurance turns out to be not the case when they're battling the disease. And unfortunately, the insurance companies will get you while you're down. And so these people are fighting for their lives. They're fighting to put food on the table. They're fighting to get their medicines, and they're fighting to pay, the electric bill. So even with insurance, they face what we call the unpredictable, unmanageable costs. And this is what's coming up in modern legislation. We're trying to make all the costs transparent, and they just definitely are not right now. So that includes co-insurance, which a lot of people pay for, huge deductibles, and out-of-network care or second opinions and that are not covered. So basically what we're saying here at Curus is this is really focused on cancer, but for all debilitating diagnoses, we feel every patient should have both a health advocate and a wealth advocate, because we want them to come out on the other side both healthy and wealthy, in quotes, right? So here we go. This is another major point that we want to emphasize, and we have a couple of case studies that we want to talk about throughout this webinar. So also the ACS, the American Cancer Society, talked about in their cost of cancer that most newly diagnosed cancer patients, they're going to have their highest out-of-pocket costs within the first 2 to 3 months. Now think about this, okay? Let's just say, and most people here on this webinar, most people in the nation know somebody or themselves that have had the diagnosis or do have the diagnosis of cancer. So the first couple of months, what happens is you are diagnosed, you have all kinds of different diagnostic tests. You have to go get MRIs, PET scans, CAT scans, x-rays, blood work, you name it. And most of this stuff is done in satellite type facilities, right? Not on campus facilities. So they're going to bill that patient directly most of the time, even though they should be billing the insurance company. So by the time this person even has acknowledged the fact that they have a terminal disease or a potentially terminal disease, definitely one that's going to negatively impact their lives and their families' lives. They haven't even really accepted it yet. They're still in that denial phase, you know, and they're really scared. Everybody's scared. And then here come the bills, and they stack up. And we have a client, what we do for her, she is we're going to use her as our case study. She's got metastatic breast cancer to her lung and bones. And it was an all of a sudden thing. She's young and healthy, marathon runner. And so what we do for her, because she's in this window, is every month she sends us all of her explanation of benefits and all of her bills. And what we do is, because we're not emotionally attached to it, we go through every line by line, everything, and then we give her recommendations of what she needs to do. So she doesn't need to worry about that. She needs to worry about going and making her doctor's visits and spending time with her family. This is a really horrible time for people that have a new diagnosis. So, and we'll talk more about that at the end, and we'll be happy to answer questions.
Didn't you, Jared, have some more success in that matter that was on the medical side that our audience may be interested in?
We sure do, and I'm going to let Sarah talk more about that because she's the expert in that matter. So,
okay.
Thanks, Mark. Yep. All right, so legislation. Okay, now we're kind of shifting gears a little bit, but current law now as of 2017 requires most private insurance plans to actually limit out-of-pocket spending. But unfortunately, that's with the conglomerate billing process. So the ones and twos that come from the side, that's not part of this. So let's just say somebody's diagnosed with cancer and they are husband or wife, okay? Or they're the head of the household and they're on a family plan. So if they're on a family plan and the average cost for a nation for healthcare is $10,000 per household, okay? Their out-of-pocket expenses already exceed that by $4,300. So yeah, the law is trying to protect us, but at the same time, it's actually working in concert with the insurance companies. So what does that mean? That means you really do not have a legal advocate. And that's why at Curus, we want to be that health advocate for our clients. So there's a 2012 survey of cancer survivors that found that 1/3, okay, had gone into substantial debt. And of those, 55% owed $10,000 or more. And this is cancer treatment alone every year. So over half, over 50% owe $10,000 by the end of the year just for the cancer treatment. That's not including any other health care. So their primary care provider, you know, if they have sniffles, cough, cold, flu, an infection, it doesn't matter. Also, on average, Americans pay, like I said, an average of $10,000 a year on regular healthcare costs, which if we total that up for every American in this country on average, that's about 20% of our gross domestic product in the country. That's almost more than any other country pays for healthcare. What does that mean? I don't know, but I think that's a substantial number. That means that healthcare is going to basically do what they want and get away with it, because if we're paying 1/5 of our GDP on healthcare, it's really hard to stop that monster. And we've taken that into consideration at Curus, and that's why we want to offer some innovative solutions for you. So if we go back, we add these up for a cancer treatment patient, okay? And that's why we call this costly treatment. That's at least $20,000 a year in added expenses to their income or to their finances. That's substantial. If I had to owe that every year, and you know, cancer treatment could go on for years. Now, granted, it's in cycles and whatnot, but it's not just the chemotherapy. It's, like I said, it's the diagnostic studies, it's the meds to get you through the pain, the nausea, et cetera, and to protect you from getting infections and whatnot. So this is a staggering number, very alarming, and this is something that we really need to help our patients. So according to the American Journal of Medicine back in 2018, I think it was October 17th, so it's a relatively new study here. 2 years after cancer diagnosis, almost 43% of all patients filed for bankruptcy. And to me, that's very scary. So almost half the population is going to file for bankruptcy if they ever get the diagnosis of cancer. and they did not delineate what type of cancers or anything. It's all averages. So a very, very alarming number as well. However, such as the case that I mentioned at the very beginning, when that young lady had her second bout of cancer, the recurrence, and she sought after a money manager, they were able to get ahead of the curve, file for bankruptcy as a protective measure. So some of this may be a positive, but very, very few. All right, so I'm going to turn it over to Sarah now, who is our lead medical engagement officer, and she's an expert at the medications here, and I'm sure she's also going to give you some very staggering numbers.
Thanks, Jared. I appreciate that. I wanted to go through and just give a few concrete examples of some of the different types of cancer medications that can really contribute to some of the outcomes that Jared was just discussing in terms of bankruptcy and financial devastation. So the first medication that I've come across is this Kymriah, which I am not even going to try to pronounce that. If anybody wants to take a shot at that generic name, I'd love to hear it. But it happens to be, it's one of the most effective, and it's also one of the most expensive cancer drugs that's ever been on the market. It's a CAR T cell drug. There are a couple of them out there. This was the first one that was developed. The way that it works is that it actually re-engineers the patient's own blood cells so they lead the attack on cancer cells. It's used to treat, you may not have heard of it. Honestly, I had not heard of it until recently when I read this article, but it's used to treat an advanced type of blood cancer called B-cell lymphoma. This is typically almost an untreatable disease, but this medication, when it was used to treat patients in a study of 101 patients, 4 out of 5 of them saw their cancers retreat. And that was only happening in about 1 out of 20 with the older treatments being used. So what it's really doing is it's taking an incurable disease and making it curable, which is something oncologists say very rarely when they talk about cancer. We don't usually think of cancer as being a curable disease. It's usually you're in remission. So this is a phenomenal drug, but it comes, you can see there, it's probably the first thing that caught your eye on this slide was the cost of the medication, which is $475,000. And that number, that's just for the medication. That does not include the cost of the pretreatment tests, the monitoring, the tests we use to monitor response, and the management of any potential side effects. So you can see that with a patient with this diagnosis needing this medication, the cost could easily exceed $500,000 and come close maybe even to $1 million. And so then the next medication that I wanted to discuss is LUDA. This one you may have heard of more. It's a medication used to treat pancreatic cancer, another devastating diagnosis, one that we usually think of as when we hear someone has it, I think everybody kind of cringes because we know that it's a very tough one to treat. But according to the American Cancer Society, this medication is really helping patients live substantially longer. It's effective. So if you have someone who's diagnosed with this is the medication to get. And the cost is $119,000 per dose. And that again doesn't include the other things that we've listed there. 8 doses are required. If you do the math quickly, you're coming up to just shy of $1 million. And Jared, you had mentioned something here I thought was pertinent to add. I don't know if you want to jump in and just
Sure.
add your experience with this medication.
Thanks, Sarah. There was a particular case that we were involved with for that $119,000 per dose. And unfortunately, at the time, LUDA was an orphan drug, which means it was brand new on the market, just FDA released and approved, and there hadn't been pricing models set for it yet. So that is a major failure on the big pharma. And that was part of our presentation again last month, to plug it one more time. But so 119,000 per dose, 8 are required. And so you do the math there. Nobody can afford that, okay? This particular patient was looking to try to go to India or England to get their care. And so involvement was made and negotiations were made, and we were able to get it down to around 69,000 per dose. However, and I'll talk about this a little bit more later, we have joined some evidence-based pricing with a consortium that I'll discuss here in a little bit. And what we were able to do then is get the cost down to $65,000, everything included. So that would be your administration of the drug itself, the doctor's visit, rides to and from a hotel, the hotel room, it's all inclusive, $65,000 per treatment. So Curus is able to negotiate these prices and really come ahead with the employer, with the insurance policy, and with the patient. And so imagine looking at that, it's still a lot of money, $65,000, but what a difference, right? We're talking about a 55% savings right there. And so, and over the course of time, it's close to $500,000, right, for the 8 doses. And the patients are more likely to adhere to that treatment regimen if it's that much less. So thanks, Sarah.
Yeah. The last slide that I wanted to talk about, and then Jared will touch on a few other issues, is this slide talks about a sample patient we have with breast cancer. And we wanted to include this because we find that unlike the other 2 medications that I discussed today, which are used to treat very rare types of cancer, this breast cancer is something that I feel like has kind of touched everyone. Everyone has, unfortunately, a family member, a friend, or even a friend of a friend that you hear about that's going through breast cancer treatment. And the financial implications of this are no joke. These medications, again, are for a sample patient, one that we deal with, and she was a young, healthy woman. And Jared's alluded to her already in this presentation, but she was she had a type of breast cancer called HER2 positive cancer. The HER2 refers to a protein that's on the cells that changes the way that they grow. And this medication, so we have specific medications that are used to target that type of breast cancer. There are usually 2, this Perjeta and Herceptin, that are given in conjunction, and they're given about every 3 weeks or so. The cost for the Perjeta is about $6,000 a month, and Herceptin is about $4,500 a month. And those are typically given for about a year. So this is the other, that's where the bulk of the cost of those 4 medications, that's where the bulk comes from. The other one's paclitaxel, that's also known as Taxol. That is a more standard chemotherapeutic agent. It's used to, so what cancer is, it's the uncontrolled growth of cells. And paclitaxel works to stop the growth of cells. It interrupts the mitosis process, so the division of the cells. It interrupts that to get that growth back under control, to stop it. And that medication is typically given every week. And then the last one is Xgeva. That medication is used the generic name's denosumab. You may have heard this. It's used to treat patients who have bone loss due to cancer metastases. And it's got a significant price tag. It's about $2,300 per dose. The thing is that this medication there's another medication that's out there that's used to treat the same thing. And it's called Zometa. And the Zometa is effective. It also works to restore bone density, but it's not, Xgeva has been shown to be incrementally more effective. And I just wanted to point that out because this patient that we're talking about here, we worked to advocate. She wanted that Xgeva with good reason. I think any of us would. If you're given that diagnosis and you know there's a medication that's better, even if it's just a little better, we want it. Well, the insurance company, because of the higher price tag, was declining to cover the Xgeva. So we got involved and advocated for our patient, and ultimately were able to help her get the medication that she wanted and needed to optimize her health.
Very good.
Yeah.
So bottom line, look at that, for what would be considered, right, Sarah, a standard breast cancer patient?
Yes.
14,000 average per month.
Right. Just imagine adding that to your budget. You go from not having any costs. These women are often, like this woman we're describing here, young, healthy, no medical problems, to go from that to now you're in charge of adding $14,000 a month to your budget. It's awful. It's devastating.
Great. Thank you very much, Sarah. That was outstanding. So what we're going to talk about now, and I'm sure Mark or Sarah will jump in here just to add some thoughts, but we're talking about some innovative solutions. So we know the problem we're dealing with, okay? We've got the answers to the test. So since we know what the answers are, how can we start manipulating the questions, okay? And together, I think we can come up with the best solutions. So some of the things that Curus does for our clients, we do this and much more. So we'll be happy to entertain any questions at the end, emails, or you can contact us directly. We don't mind, but I mentioned this earlier. So one of the things that we've begun to do with our clients is, at least initially, is a comprehensive review of their EOBs, or explanation of benefits. And I don't want to preach to the choir because I'm sure all of you know what that is and how important that is to understand them. But I didn't, as a provider, that's not one of the things that I was very good at back when I was in the Air Force, and for many reasons. But I've gotten really good at it now, and I fully understand from insurance company to insurance company, from TPAs, PBMs, et cetera, basically the impact it's going to have on certain diagnoses. Now, we talked about this briefly last month, and we're going to talk about it again next month, but there are certain carve-outs that employers and TPAs are looking for help. And there are 5 of them, and they all seem to be, the one common denominator with them all is very expensive medications, okay? These costly medications that we're talking about. And the first and foremost is cancer treatment. And that's why we're putting this webinar today. We want to increase awareness of how expensive it is as soon as somebody gets that diagnosis, and what it does to themselves, their families, and their bank account. And so by looking over the explanation of benefits, we help them realize, okay, these are your rights. This is what you can expect. And not only that, but then we go on and we do monthly audit of medical bills. So what will happen is most of our clients will send these to us via secure email on our Curus accounts, and we will go through it line by line. And we'll look at everything. Where'd this bill come from? I found one with a client the other day. It was $14,300 something from a pediatric clinic, and they don't even have kids. Okay, and so where did that come from and why? And so we've looked at other bills. Our case client that we're talking about, we've already saved her upwards of $13,000, and that's just in a few months of out-of-pocket expenses. So you know, that's something that just having a third party, a financial, you know, money advisor, a health advocate can help out substantially. So, and the other thing,
Jared,
go ahead, I'm sorry.
I'd like to add another example, and it's a little off of our subject, but it really gives you a flavor in this area about EOBs. I found that as people receive them, they find them to be unnerving because they basically are hard to understand, and people are trying to figure out, what did I get and when did I get it? We had a situation a while back where one of our members got an EOB for, and actually a bill for $56,000 for services that proved to be out of network. And naturally, he was very upset and very unnerved by that amount of money. And so we took that matter and reviewed it very carefully. And we did 2 things. We went to the insurance carrier and said, okay, what is your out-of-network reimbursement? And we got that number. And then we went to the hospital and raised the question of what is the contractual reimbursement that you invoice for the HMOs that you have contracted relationships with. And the individual basically wouldn't tell us, but we knew, and therefore we suggested to them that number was about 32.4%. And she laughingly told us that was about 0.1% off. And we were able, through that negotiation, to assure her that she would receive the out-of-network payment, and then she would receive a payment from our individual member of the differential between the out-of-network payment and the amount that they would normally receive from one of their contracted insurance carriers that they receive payment from. And that proved to be a number of about $5,400. And when we called our member and said, look, this is now a $5,400 resolution, he was naturally thrilled and amazed, saying, how did you all do that? And it's the process of understanding that the EOBs are like the beginning of a roadmap to trying to resolve these expensive healthcare costs on drugs and on services.
Very good, Mark. Thank you for that. And we've got many more Curus success stories that we'd be happy to forward to you upon request. So one of the things I was going to get at next is Sarah and I have found through our work together that if we request an advocate from the insurance company, it's like having another lawyer, if you will, to give you an anecdote, that you settle out of court. So what happens with these advocates, and they have them, we didn't even realize this. So big insurance companies will have these advocates, and they'll assign cases, and we pester them as Curus pesters them. And first 2 or 3 calls, they usually capitulate and say, all right, fine, we'll cover that matter. We'll give you this or we'll give you that. So, you know, working with the member, working with their insurance plan, working with their TPA or PBM, and also working with advocates, we don't pull any stops. We want to make sure that this is successful for our client. All right, moving on. So one of the things we talked about a little bit last month, but our Curus Health Navigator Formulary, and this is proprietary formulary that we've created. And what this is we have this updated monthly, and we have a source, RJ Health, that gives us the data on what all the pricing models are. And again, we talked about this last month. So what is the list price? What is the wholesale acquisition price? You know, what's the actual price for the customer and for the insurer and everybody else? And then what are the rebates? And so what we can do, if necessary, is we can pull this formulary out and say, look, like we did with our cancer patient, say, look, hey, you're charging WAC or ASP plus 20, and that's just uncalled for because we know what the real prices are. How about WAC or ASP plus 6 or 10? And then obviously we've saved everybody a lot of money with that. So this formulary, we're in works with a TPA right now for significant carve-outs for those 5 areas that we talked about, and saving substantial amount of money for everybody. So I mentioned and I alluded to earlier, we created, these are another innovative solution that Curus has come up with. We put together 16 centers of excellence for cancer care. Why we call them centers of excellence, we're very stringent on our parameters. They have to meet all of their criteria for licensure. They have to follow all evidence-based practice. They have to follow research and participate in research that is obviously funded by either the government or some facility. And they have to be certified in their particular types of treatment. So all 16 of these are, and we've combined them all into one consortium, and they're nationwide. I'm going to show you a slide here, but I'll come back. And what we've done is we've combined their care with evidence-based pricing, meaning, all right, what really, according to the research, and this is kind of a new, very tip of the spear, innovative thing to do. On average, in this region or this state or this locality, what does it really cost to treat this particular cancer? Because what Big Pharma will do is say, oh, well, you know, LA, California, or New York, it's going to cost, you know, this amount, 300% inflation. But Nebraska or Montana or Idaho or Ohio, it really, it's you know, it's at cost. It's, you know, maybe 10% above cost or whatever. So we've combined that, and we've done a combined care. We've done the medical travel where we can get the patient there, and for a very lower cost and higher efficiency, they have everything inclusive, like I talked about before. So we're trying to expand this in our business plan. In the future, we'd like to include orthopedic, OBGYN, and especially, and this is hot on our radar, mental health. Mental health is one of those, it's what cancer used to be in the nation. Remember, everybody's grandma or grandpa would say, oh, they got that C word. They wouldn't even say cancer, right? Mental health's that way now. It's the negative stigma. And we at Curus fully believe that you go get your medical checkup, you get your labs drawn every year, you know, whatever. You need to get your head examined too, right? So it's really important for medical health checkup and not to negate that. So That's in the future, but for right now, we have these centers of excellence that will provide just stellar care at extremely reasonable costs. So that's kind of what I'm talking about here with the centers of excellence and evidence-based pricing. So we're at the tip of the spear. We're way ahead of everybody when it comes to, like I said, EBP, evidence-based practice and pricing of that and putting it at the bedside. We even have a different division of Curus that's going to work on this for the inpatient setting. So, okay, I'm going to turn it back over to Mark because I'm sure I bored you all to death. And I appreciate your time. And we've just got a few more comments, and then we're going to open it up for Q&A.
Thank you, Jared. And thank you, Sarah, very, very much. The idea behind the reality of this slide is that chronic stress not only has a negative impact, it is frankly a causer of disease. If you are constantly under stress, it exacerbates and increases your potential for particular diseases, heart, stroke, and the like. And there are even a significant number of studies that have shown that stress increases the potential even for cancer diagnosis. So the body reacts to stress very adversely. And I think what's really important is that financial stress is as much a part of this situation as is physical stress. So when you see the pressures that are faced by people who have extensive bills for cancer, that's why the study talked about from Duke about financial toxicity. It's an indication that the reality is that when you can't pay for your drugs and you've got to make choices between your drugs and your food and your housing costs, it puts you under extraordinary pressure and is more likely to lead to greater increases in your illness. So all of these things play a very, very important role in the process. And that's where Curus comes in, because frankly, we try and eliminate as much of the stress as possible. Can we eliminate all the stress? Absolutely not. Nobody can eliminate all of the stress, but we can help you manage both the financial stress, the physical stress, the emotional and mental stress, because we're equipped to navigate through the system. Sarah had an interesting experience just this week, actually, when one of our members wanted to get into Mayo Clinic in a particular location and was prepared to go. And Sarah called Mayo Clinic, as we do. We provide all of that service, and was trying to arrange for the care. And the coordinator at Mayo said, oh, yes, we've just had a cancellation for next week, but we don't think that that's possible, that you can be prepared, because we need that patient's medical records. And Sarah smilingly said, well, we have all their medical records, and we can get those records sent from our EHR, electronic health record, to you almost instantaneously. So we can put you in the position of having those records and seeing that patient just when they want to. So the real value of what we're providing here is a continuation of the management of care, the reduction of stress, and the control of the costs of care, because we work very hard to try and reduce the costs of the medications. As Jared and Sarah talked about, we've negotiated these deals at wholesale acquisition costs +4 and +6 for infusion and oral drugs, whereas the Blues are paying 20%. So there's a huge margin, as Jared related to that. So we're here to manage the stress, to carry as much stress as possible, and to help our members become healthier, because they know that someone has their back in the process of care delivery, is going to answer the questions, is going to push for the right drug, and is going to push for the best pricing and the best quality of care possible. And we would like to engage you if you have questions for us in this session, or frankly, if you reach out on the next slide to either Jared or me, we'd be delighted to answer any questions you have about how Curus can play a role with your members and can play a role in helping to improve quality of care and reduce the cost of that care. We thank you for participating and look forward to seeing you at our third session, which will be upcoming late next month. If you can join us, we'd be delighted to have you. Thank you again, and we welcome any questions.